In this video, I'm going to talk about muscles of the hand. So you can kind of divide those muscles into maybe 4 general categories. One is the long muscles of the thumb. You can talk about the short muscles of the thumb, or what's called the thenar eminence. You could also talk about muscles of the hyperthenar eminence, or of the 5th digit. And then there are the intrinsic muscles, which are deep muscles of the hand. So I'm going to talk about the intrinsic muscles first, and that would include the dorsal interossei, the palmar interossei, and the lumbricals. These are somewhat complicated muscles. I'm not going to talk about them a lot in terms of how they function, except to say that you don't really have a functioning hand without those muscles. Okay, they provide a really important role in moving the smaller joints and working with the tendons to really be able to move your fingers appropriately. So the palmar interossei come from the base of the 1st, the 2nd, the 4th, and the 5th metacarpals, and they insert into the base of the proximal phalanx of the 1st and the 2nd and the 4th and the 5th digits. And the palmar interossei are going to adduct and flex at the MCP and help extend at the IP joints, and the nerve is ulnar. The dorsal interossei come from the 2nd and the 3rd and the 4th shaft of the metacarpals, and they insert onto the distal or the proximal phalanx of the 2nd and the 3rd and the 4th digits, and they help adduct at the MCP joints. And then they also help flex at the MCP joints and extend at the IP joints, and their nerve is ulnar. The lumbricals come from the tendons of the flexor digitorum profundus of the digits 2 through 4, and then they kind of come around and insert onto the extensor aponeurosis of the 2nd through the 5th digits. And the lumbricals flex at the MCP joints and extend at the IP joints. And for the lumbricals, the digits 2 and 3 are the median nerve, and digits 4 and 5 are the ulnar nerve. So notice the intrinsics are mostly the ulnar nerve. For the long muscles of the thumb, the first thing I'd point out is what's called the anatomical snuff box. So that's kind of when you kind of extend your thumb out, you'll notice that you kind of see these tendons kind of pop out, and there's kind of a space in there. The scaphoid is actually the base of the anatomical snuff box, and it was named for back in the day. You could put your snuff in there and then start it up there. So anyways, this top tendon is the extensor pollicis longus. The extensor pollicis brevis is over here, and the abductor pollicis longus is over here. Okay, so that's the anatomical snuff box. So for the muscles, the extensor pollicis longus is going to come from the interosseous membrane and the ulna, and it's going to insert into the base of the distal phalanx. That's the extensor pollicis longus. The brevis is going to come from the interosseous membrane and the radius and insert to the base of the proximal phalanx of the thumb, or the first digit. And they're both going to extend at the MCP joint, and the extensor pollicis longus is going to extend at the IP joint of the thumb, and the nerve is radial. The abductor pollicis longus comes from the radius and the ulna and the interosseous membrane, and then inserts to the base of the 1st metacarpal, and it's going to abduct at the abduct ABD at the CMC joint. Okay, so the carpal metacarpal joint, and its nerve is radial as well. The flexor pollicis longus comes from the interosseous membrane and the radius, and it's going to insert onto the base of the proximal phalanx of the thumb, distal phalanx of the thumb, because it's the longest. It goes a long way, and it's going to flex at the CMC, at the MCP, and at the IP joint, and its nerve is median. And those are the long muscles of the thumb. The short muscles of the thumb include the aponus pollicis, the adductor pollicis, the abductor pollicis brevis, and the flexor pollicis brevis. So the aponus pollicis comes from the tubercle of the trapezium and the flexor reticulum, and inserts onto the whole radial side of the thumb, and it's going to perform opposition and flexion. and its nerve is median, as are most of the muscles of the thumb. And then adductor pollicis, adductor pollicis, comes from the base of the second and the third metacarpal and the capitate. It's going to insert to the base of the proximal phalanx of the thumb. It's going to adduct the thumb, as well as perform flexion of the thumb at the CMC joint. And its muscle is ulnar. So I know I just said most of the muscles of the thumb are median, and that's true, but the very deep muscles of the hand are ulnar. So adductor pollicis is ulnar. It's the only muscle, it's one of the only muscles of the thumb that are ulnar. Abductor pollicis brevis comes from the tubercles of the trapezium and the scaphoid, and the flexor ranaculum inserts to the base of the proximal phalanx, and it's going to abduct at the CMC joint, and its nerve is median. And then flexor pollicis brevis comes from, it's got two heads, a superficial and a deep head. The superficial head is flexor ranaculum. The deep head is the trapezoid, the trapezium, and the capitate. And they're all going to both insert into the base of the proximal phalanx. The superficial head is median, and the deep head is ulnar, and it's going to abduct to the CMC joint, as well as flex. And then